Hi, and welcome to episode 118 of the Untethered Podcast. Today we have Dr. Jasmine Elmore joining us. Dr. Elmore is a board-certified pediatric dentist, a certified specialist in orofacial myology, and is one of the few people in the world to have a professional degree in the science of breathing behavior analysis. Her personal pain journey led her to airway dentistry. She's been fortunate to be trained by many of the legends in the field. Her airway fairy godfather is Dr. Barry Raphael, who personally trained her in his office after she completed the airway mini residency. She's the first dual mini resident proctored by both Dr. Sarush Zaghi and Dr. Chelsea Pinto at the Breathe Institute. Dr. Elmore has taken courses with Ron Reska to learn more about the postural restoration and is active patient in the therapy. Combining her studies with Drs. Ted Belfour, Kevin Boyd, German Ramirez, and so many other leaders with breathing behavior has helped her holistically heal both children and adults alike. Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Welcome to the Untethered Podcast. I am your host, Hallie Balkin. I'm a certified orofacial myologist, feeding specialist, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, tethered oral tissue, and airway space. I challenge you to keep an open mind and join my mission to get this information out to the masses. Let's get started. Well, Jasmine, thank you so much for joining me on the podcast today. I'm really excited to finally connect and to learn a bit more about you.
Thank you so much for having me. You're now my new favorite Hallie. You have supplanted Halle Berry as my favorite of all time. I just wanted you to know that. So happy to be here today.
Oh, thank you. It's so funny you say that because people always go, well, is it Hallie or Haley or Holly? And I'm like, Hallie, like Halle Berry, because nobody forgets her name. So I love that you said that. I was like, that's exactly how I say my name.
I did some research beforehand and I said, yes, you know what? This makes sense. This is why I love her so much. So I'm glad to be here.
Love it. I'm so glad you're here. So let's talk. Will you tell everybody a little bit about like who you are and what you do first?
Wow. Yes.
The loaded question.
It's always complicated now to describe to people like, what do I do? Right now, what I do is I work with new moms and I work with I'm like the Eastern version of Breathe Institute, or what we're trying to establish here. And we do a lot of tongue ties, lip ties, things like that. 6 months ago, my airway practice was a little bit broader in view. We just have gotten so many new moms on board that it made sense to just kind of focus on them right now. But 6 months ago, I actually worked with infants, toddlers, children, and adults for airway assessments. So they come in with all a host of issues and problems, and we kind of start at the beginning, look at the way they sleep, look at the way they breathe, chew, walk, talk. I mean, it's a full 2-hour assessment. And then from there, put together holistic treatment plans that start to untangle those issues. So I've been doing that, not on my own for a long period of time since September, but I've studied that for the last 3.5 years. So it's cool stuff. I love it. I love helping people breathe better, sleep better, and just live better. So it's awesome.
Yeah. And I love that what you said there, that, you just love helping them breathe better, sleep better. It's overall your function improves. And it's so crazy because a lot of my older patients, like my adults, will say things like, I didn't realize what I was missing out on. Like, I didn't know that life was actually supposed to be this way. I just was so used to going through like my daily life the way it was that you don't know what you're missing out on until all of a sudden you have the ability to function optimally, function maximally, without compensation. And then all of a sudden you're kind of like, whoa, I don't have to be tired all day, or I actually wake up feeling rested, or I can go for a run and breathe through my nose, or, it's just all these like little things that nobody teaches us. We don't think about this. We just accept life is and go about our day.
Yeah. Yeah. I mean, most of the adults that I was seeing, we don't know what we don't know. It's almost like a badge of honor, especially if you're an entrepreneur or you're a helppreneur. It's a badge of honor to be tired and overworked, and we kind of compare like people, what did you do today? You don't get any points for I was on the beach. Oh, you don't get points for that.
Uh-huh.
No, it's, I had this patient and this patient. Oh, and this patient was crazy. And then this, and that's like where you really get people excited, telling all the war stories of clinic, So to really kind of present a new light, it's kind of like, hey, did you know you can get more done during the day by doing less? People are like, what? And I was
Uh-huh.
like, what? When people first kind of introduced me to this, I was like, there's no way I'm going to have more energy doing less stuff. There's just no way. And actually, that's exactly what ended up happening. So, yeah, I mean, it really is one of those you don't know until you know type of things,
Yeah.
which makes it difficult to kind of always have conversations with new people, because it's like, this sounds like this is a gimmick. This is too good to be true. What
Yeah.
do you mean breathe through my nose? What is that going to do? And then people just, trust you enough to do it. And they're like, whoa, I can't believe I didn't do this sooner. This changed my life. Yeah. So it's cool stuff.
Yeah, it reminds me of a meme that I saw last week, which is a version of other memes I've seen in the past. And it's like, the Europeans, they put up an away message. It says like, off to the beach or off to the mountains for 3 months, catch ya in September or October. And the Americans are like, going in for heart surgery, but I'll be available on my phone in 2 hours. Feel free to text me. Like, I mean, what's up with that? Like it's like we wear this hustle attitude with a badge of honor. And I have in my coaching programs, because I also coach, female entrepreneurs, especially like in the medical space, in the private practice spaces. I've really, and it's funny we're even talking about this because I'm creating we do a monthly training, and the monthly one that I'm working on right now for them this week is talking about like mom guilt and, actually being present for what you need to be present for right now. And like, we've talked about boundaries. We've talked about setting those hours and respecting those hours for our families, for ourselves, for our patients. And it's really, it sounds like a good concept, but it is so ingrained to do the opposite in American culture that it's almost like we have to work hard to not be that way. And people look at you like you have 5 heads when you suggest that you can have like a very successful business and still treat your patients and have very happy, successful, healthy patients and still take care of yourself and your family. And it's, this whole like misconception of like balance. I'm like, there's no such thing as balance. There's boundaries. We need boundaries in our life. We need to take care of ourselves just as much as we take care of our patients. So yeah, I know
Absolutely.
that's definitely a favorite topic of mine.
I need to get into this coaching program. We'll have to talk about that afterwards. I didn't know you were doing that. That's amazing. And
Yeah, well,
so
we can chat.
necessary. So necessary. I love that.
Yes. Yeah. So tell us, so you had said that you're working with adults or you were working with adults, really the lifespan, but now you're really focusing on the itty bitty babies. So is it, and you mentioned it's just because you've had such an uptick in these mamas coming into the office. So is that your new niche? Is that really where the future of your practice is headed?
Yeah, the new clinical niche. Yes. I
Mm-hmm.
still do a lot of consulting with new myotherapists and old myotherapists,
Awesome.
new airway docs, older airway docs. So I actually help more adults now than I did 6 months ago. I just help them from afar, usually
Okay.
in Zoom conversations and meetings and things like that. But yeah, I mean, you're a mom, the new moms, they require a certain special set of attention that once they started to come into the fold, I thought, okay, at least for now, we will just focus on all of my new moms. They need a different type of attention than like my patient after this is a 4-year-old, and it's a little bit of a different
Yes.
type of therapy. So, but yeah, I still help those adults for sure, because many, if not all of them, struggle from the same things that I have struggled with. And so there's a bond there that we just can't let go. So,
Yeah.
and I love it. It's cool stuff too. So,
Yeah. And I'm similar too in that my focus has always been like actually before I had my own kids, I was doing more toddler preschool age feeding therapy and motor based disorders, and then had my own tongue tied baby, and that really threw me into infant feeding. And then from there I threw myself into myo, and it's kind of been this like snowball effect of like and so now I still like my practice does treat adults and older pediatrics as well, but really like the meat and potatoes of who we see are really those infants and toddlers and like earlier aged myo cases, like in the elementary age kiddos, which is exciting because, for me, I'm like, the earlier we can get in there and start making these changes, the better for these patients, for these little ones. And then, you always have the moms or the dads, the parents, the guardians sitting there going, I think I have this issue. Can you look at my mouth? And you're like, here we go.
Absolutely. And that's why I still work with adults for the functional frenuloplasties, because they're like, oh yes, hey, do you want to? Sure. Come on now.
Come on over.
We got room. Come on. But it's all of it is really cool stuff. And the majority of it, like you said, is just to see people's eyes opening and going,
yes,
wow, I need to be a little more attentive in figuring out if that really does apply to me. And then they'll come back in a couple of weeks and go, man, you read me like a book. How did you know? Yeah, well, I struggle with the same stuff, welcome to the club. But yeah, it's just all of it is just really exciting, new for this area in North Carolina, and just cool stuff.
So. Where are you in North Carolina? Because I might have a referral for you. Someone just contacted me yesterday.
Oh, great. Well, my office right now is in Durham, North Carolina, okay, which is near the Triangle, the Raleigh, Cary, Durham area. We're opening a new location in August that's attached to one of the big hospitals here. So I'm really excited about that. We'll be right down the hall from a pediatrician's office. And so for my 0 to 3, the new office is kind of like pretty much specifically 0 to 3, but yeah, it's cool stuff. And like I said, still throw some adults in there every once in a while, but yeah, so Durham, Raleigh kind of is where we're situated right now. And I also have a New Jersey license, and I mean, me, there's got to be some excitement in there too, but
absolutely, I got to change it up a little. But I've got my Maryland DC license. I'm moving to Florida soon. It's public information now, but my practices will still stay in the DMV area, but I will physically be in Florida. So my team will be here in Maryland, DC, and Virginia still. But yeah, no, it's amazing, and it's so exciting to see, to see this spreading throughout the United States. And I feel like there are other parts of the world that are ahead of us and their knowledge base in this space. And so it's really exciting to see even just a few people popping up here and there, because if we can get, like we said, if we can get this to become more mainstream knowledge, the changes that we will see just overall health-wise for pediatrics and adults, it's incredible. So will you share with us, because you said you've had your own journey. So will you talk about, I don't know where you want to start, if you want to start about start where you realize this was an issue as an adult, or have you known ever since you were younger that there was something going on, what those symptoms looked like, as a child? I defer to you. You tell us your story however you want to, but I think it would be helpful for others to hear.
Yeah, no, my story is, I always call it a funny story. Just even how I became a dentist is a funny story. I just randomly one day received a phone call from a guy I'd met years before. He was a family friend, but I didn't know him very well. And he called me like, hey, yeah, so you're going to be a dentist. And I'm like, what? I'm going to be a what? First of all, who is this? Hello, how are you? And what? At that point, we didn't go to the dentist. My mom has extreme dental phobia. Oh. We didn't go to the dentist. She hates when I tell people that, but that's the truth. She's not a bad mom, but we just didn't go,
It's a real thing.
And this is real, and so I went to his office because I just was curious as why this guy called me, and I fell in love with the profession of dentistry the first day in his practice. He's 6'3", almost 500 pounds. He's a real life teddy bear. And the kids loved him, and no one ever really talked about teeth. It was soccer practice and dance, dance things and dance groups and all kinds of cool stuff.
Amazing.
So that's actually how I became a dentist, from a random phone call one day from this guy that thought I'd make a great dentist. And so my journey into airway is actually really similar. I was working 20 to 24 days a month, just living my best, overactive, work life, loving every minute of it. And I started having this shoulder discomfort that was starting to now become shoulder pain. And it was pretty debilitating. So a friend of mine was like, hey, I know you're seeing some PTs. And I was doing okay. I wasn't doing great. I still was having a ton of pain with 3 sessions a week of PT. It just wasn't working for me. And these were really you don't understand, Hallie, I'm talking about super qualified PTs. There were NFL and NBA athletes in there training with me, quality PTs. nothing against their knowledge and skill set. It just was not working for me specifically.
Mm-hmm. Yeah.
So my friend said, hey, I know this PT, his stuff is a little bit odd, but I think it may help you. You should check him out. And of course, he didn't accept insurance. And so just even though I had the money, just like a reason to go, oh, I'm not going to go see this guy. Like, no. But I'm glad I did because he was able to help me. Actually, let's back up. I fell in the shower. So even though I was having the shoulder pain, I banged my ankle up pretty good. So most of my PT work was like 25% shoulder, 75% ankle. That's important because within 3 sessions with this new PT that she recommended, he was able to 100% resolve all of my pain and all of my swelling in 3 sessions. And I had been in months and months of PT with these other PTs. So because I had this trust factor with him now, I said, hey, my shoulder, I don't know what I got going on. Maybe it's former athlete stuff plus dental stuff, but like it's bad. I need help. And so he's like, hey, can I do my traditional therapy? Not pain management, but like my real therapy. And I'm like, you can do whatever you want. Wave a banana over my head. I don't care. Like,
as long as it works, do whatever you want.
Do whatever you did for my ankle. Just if it's the same thing, by all means, just I trust you. So he's like, tell me about your teeth. And I'm like,
why?
Mike, I'm a dentist. What do my teeth have to do with my shoulder? And he's like, okay, let me back up. Do you dance? Do you have rhythm? And I'm like, what is this? I mean, the questions were so odd. Like, how do you sleep? I'm like, I sleep fine, Mike. How do you process stress? I'm not stressed. And he's like, Jasmine, you live a really stressed. Are you sure you're not stressed? I'm not stressed, Mike. I'm fine. So he started just at the beginning with this weird like teeth and dance. I'm like, what the heck does this have to do with my shoulder? Like, you didn't do any of this stuff with my ankle. So he was the first person that said there's a link between your mouth, your diaphragm, how you breathe, your feet. There's no surprise that you need orthotics. There's no surprise that you've had a history of knee issues over the years. These things are all related. And I was just like, I've never heard of my teeth being related to anything with my feet, nothing with my shoulder. And at that point, I was maybe 3 years out of dental school. So I'm like, Mike, like, okay, you're taking the trust a little bit too far. Like I trust you, but like
back
this,
it up a little bit
like,
here,
buddy.
buddy.
Let's go back a little bit. Never heard of this, But with my personality the way it is, I'm really open to anything. I'm not gonna say someone doesn't know what they're talking about unless I've done my own research first. So even though I'd never heard of it, I mean, there's plenty of things I've never heard of. I don't have an ego big enough to say like this doesn't exist. So I took that as an opportunity to start learning stuff. And that was probably the best and worst thing I ever did, because from then on, it was like, okay, I don't want to drill and fill teeth anymore. I literally want to only focus on this because I see these same issues in the kids that are in my chair every day. How did I miss this? Like, not even tongue tied, just kids sitting in a chair with absolutely the worst posture you've ever imagined, breathing so loud you can hear it in the hallway. Just simple things. And I started asking parents at that point really simple questions because I didn't know a whole lot back then. And when I'd ask about sleep, they would go, oh yeah, they can't sleep through the night. They wake up, they've got nightmares, they use the bathroom, they this. I'll get up at 4 o'clock in the morning to get ready for work and little Johnny's already up. And I'm like, what? Because that wasn't my experience. I go to sleep. I'm a heavy sleeper, so this was the first time I'm hearing about like night terrors. And then one of my friends had a baby who turned 2, and I started hanging out over there just to learn more when she told me night terrors, and I got to hear them. And I was thinking, my goodness, I can actually help people better than I can as a traditional dentist if I can understand how these night terrors are related to mouth breathing. And he had his tonsils removed, and it just was so many patterns. And I was seeing it in 2 kids, and then 4 kids, and then 20 kids, and then 100 kids. And then I was like, okay, I've got to like now really go all the way in and help these kids, because trying to learn myofunctional therapy at 30 is hard. It's hard. I'm not gonna lie to you.
It's me. I hear you.
It's hard. It's hard stuff. Like part of my brand, what makes me me is I tell parents like, this stuff is hard. Let's not pretend this is easy. This is difficult. It's much easier with the neuroplasticity of a 3, 4, 5-year-old than it is with a 35-year-old. And that's just real talk. So it started with me and my own research. I took a lot of classes with PTs, understanding just the body connection. And before I really understood the tongue posture piece, I really had an appreciation for body posture because I've had awful posture ever since I was a kid. But my mom, of course, didn't know that that was related to the mouth breathing I was also doing. And, it's just all connected. So I kind of fell down the rabbit hole trying to resolve my own issues and realized that these kids have the same problems. And then, of course, the icing on the cake was my mom. I was around Christmas time a couple years ago, and I was like, "Hey, mom, did you ever try to breastfeed me?" And before she could answer, I was like, "Was I colicky and fussy and have jaundice?" And she looked at me like, "Were you talking to your grandma? How did you know this stuff? Like, how did you know this?" And I said, "Oh, because I work with those kids every day." And I guessed that based on the fact that I have a tongue tie and some other issues that I probably experienced that. And she was like, "You described your breastfeeding experience to a T." Like she said it was like a 2-month thing. And she had to just,
That
and
was the same with
that
mine.
might
Yeah.
even be generous 2 months. I mean, she just
Yeah.
was like, "You just couldn't do it." And then of course I was allergic to every milk, and it was
That
just
was
so
me.
funny. Right. I mean, and it was,
My mom was like, also, 35, 36 years ago, there weren't that many alternatives. And she was like, the soy-based stuff smelled like dirty socks. So you literally would spit it out immediately. It wasn't whether or not you could swallow it. You refused to drink that. She was like, you were not easy to feed as an infant.
yep. It's like we're twins because my mom
We
said that was
are.
my experience as a kid. And I remember she was just like, "What does this have to do with like the dental stuff you do?" And we had like a 2-hour conversation. And the look on her face, I will never forget it. It was like a mixture of guilt. And I was thinking, why is my mom guilty? But probably the flaws I have. I'm not a
That
parent
mom
yet.
guilt.
So,
Yeah.
it's like I didn't understand like why is she guilty? It has nothing to do with her. But it was just like a look of shame and guilt. And then like almost like, how did I not know? And this is me at like 30, and I
Right.
thought, man, if she's feeling that with a 30-year-old child, what are these moms feeling with 2-year-olds or 6-month-olds?
Yeah.
And that drove me even further to really want to help parents and kind of come not so much from a doctor approach, but like child of single parent mother approach. Like, hey, I know how my mom felt to know that I had struggled with something for 30 years that was easy and simple to fix in her mind. Still don't know if I say it would tackle easy, tag that to this problem. But in my mom's mind, it's like, man, if I had known, I would not have hesitated to do something.
Yeah.
And, wow, I feel like such an awful mom. And I just was like, "Mom, you're the best mom ever," but that really, really cemented it in for me. Like, this is what I have to do. I need to be in this space. So yeah, I mean, that's how I got here.
I love that. I mean, I think, and what's so interesting is when I started this podcast, it was because nobody else was talking about this yet. At least nobody in the space that I'm in, where I went to look like, is there a podcast for SLPs, OTs, RDHs in the myofunctional therapy space who are talking about myotots, airway, and feeding even? Because if we're talking about the kids under the age of, under traditional 4-year-old myo age, well, we can intervene sooner. And so I know certain professionals tackle that versus, like we're not doing myo per se at that age. We might be, I call it feeding with a twist of myo. We still need to have our myo knowledge. We need to have our TOTS knowledge. We need to know how to assess and treat, diagnose, all that stuff. But what it comes down to is, you're exactly right. These moms sitting in front of me in tears with their own partners sitting next to them, thinking they're absolutely insane and going, why are we spending this money at, because we're private pay, why are we spending this money out of pocket to sit here and have her tell us this when the mom is sitting there feeling so validated because she's like, nobody has listened to me. Everyone has told me I have like all these different mental health issues, which some moms do. I'm not downplaying that at all. And sometimes there is PPA or PTSD or PPD. There's all kinds of real issues going on, which is even more of a reason why we should be arming our moms with as much support as we can in these postpartum months. But, it's like to have a pediatrician or another doctor say to you, "Oh, your baby's fine. They're on their own growth curve." But mom is like struggling around the clock. And then to have your partner who lives with you to basically latch on to what another professional said and not support you because they don't know. And for them, they're doing the best they can with the information that they have. It's a really slippery slope. And I really love and appreciate every provider who steps into this space to work with these families, because we need more people. These mamas need support. And it's been incredible too, because a lot of them have started listening to this podcast, and they'll reach out to me and they'll say, hey, who do you know in this location? Or, just thank you so much for even bringing light to this topic, because I knew something was wrong. I didn't know what was wrong, but I knew I wasn't crazy. And it's like all these alarm bells were going off, and everyone was telling me I was basically insane for even thinking that something was wrong with my child, or that, there was something off about our feeding relationship. And anyway, so that's become a major passion project of mine, because I never set out with the intention to create material for parents. It was actually for professionals. But the fact that we have all these mamas hanging around, and then also to add to that, moms within our field, parents within our field who didn't know and who now know, who can also go out and spread this information and make it more widely available. It's like, for me, my heart feels so full. Like when I speak to another provider who works with moms of babies and infants and toddlers, because man, that is a hard population. It takes energy, it takes time. You have to be patient, and you really need to know what you're talking about, because they're not just mini adults. They are totally different anatomically. They are totally different behaviorally. It's, my friend and colleague, Autumn Reed Henning, calls the toddlers no man's land. So it's like, that's the area where it's hard to find providers who will even release a child that age sometimes, because we know it can be tricky. And I'm super lucky because I have an oral surgeon local to me, and I have pediatric dentists local to me who are in this space, who will release, and many who do place sutures, and they do not require general anesthesia. This is all local. So it's really great that we're able to offer this to our families in the DMV. But oh my gosh, it is like you, like I was that infant, and I know that my mom would have done everything in her power to do what she needed to do had this information been provided to her. So it's so interesting to look back at our own stories and where we were, as children, and where we are now as adults, and the snowball effect that, it's taken its toll on all of us as adults who didn't have that early intervention. So what do you mind sharing, like where you're at right now with your journey? Because I know you mentioned, you're an adult. It's not as easy to unravel all the pieces as an adult, because there certainly are more. But where are you at in your journey?
Yeah, so I'm starting with myo right now, and it's
Awesome.
difficult. I've gained about 25 pounds in the last 18 months, and it was not COVID related. It was traveling up and down between New Jersey and Dr. Barry Rayfield and Clifton. He's my airway fairy godfather, and I've learned so much stuff from him, and he let me apprentice with him for a full year, which was a huge blessing. So my body kind of going out of routine, it was like the one thing I tell parents all the time. You'll find it almost seems like there's just one life-changing thing that just kind of pushes you over the edge, but all the other issues and factors were building. You just didn't know until the one thing happened. So I've learned that in also trying to, be physically fit again. This is somebody who used to work out 6 days a week and bodybuild and train. So falling off of the wagon that hard and trying to get back on is a challenge. Adding myo into it is, of course, also a challenge. But I'm going to have Dr. Zaghi perform a septoplasty on me this summer as well. So, yeah, I mean, just my breathing, just starting at the foundation of the nose, my breathing in and of itself is compromised. And I played sports, got hit in the nose so many times and never really thought about it because, we compensate really, really well. And I was thinking while you were talking, I was like, oh, I have to mention that what I do, I more so work, even though in my traditional pediatric dental world, I work a lot with special needs kids. I mean, that was pretty much the majority of our referrals are for special needs kids or kids who've had really negative experiences at the dentist. That's what I did as a traditional pediatric dentist all day long. But more so, I've noticed in my fee-for-service office in this new practice, I work a lot with kids who were kids like I was, right? Like top of their class, A's on everything. These are the kids that get really left behind because no one thinks, how are you struggling when you get A's and everything? How are you struggling when you're doing debate club and sports? And no one's paying attention to those kids who are breathing through their mouths, those kids who are grinding their teeth, those kids who are snoring, those kids who are, in my case, tripping, even though I was the number one athlete. And if something fell right now from the ceiling, I probably could catch it. I have amazing hand-eye coordination. But when I walk, I trip into things all the time. In the peak of COVID, I had to have my toenail removed by the doctor because I stubbed my toe in the same segment of my master closet 3 weeks in a row, as if that wall moved. It's been there, been here for 5 years. The wall's been in the same location. But I stubbed my toe on the same corner of my bedroom master closet so much that my toenail was like 10% attached, and I had to go to the doctor to have it removed. When I mention that to parents, then you get stories about kids who are clumsy and trippy and tripping. And I'm thinking, I have tripped and stubbed my toe so many times as a kid. I was the kid that my mom used to say, oh, you're a hypochondriac, because something was always like hurting, but then like the next day it wouldn't. And again, straight A student, doing all these things, not behind in class. No one really cared. No one would have thought that I had an issue or that there was anything, resting below the surface, with the mouth breathing obviously being the huge red flag. But I noticed in a lot of my courses, we talk about kids, and rightfully so, we talk about kids who are struggling, who have ADHD and autism and these type of things. And they're a really important population to focus on. I almost focus on the kids who are over excelling because sympathetic nervous system dysregulation is very frequent and common in our profession. These professionals, I'm one of them. We cope really well. We're overcomers. We can overcome any challenge. Those are red flags for somebody whose sympathetic nervous system is in go, 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 go all the time. Parasympathetic, hey, never met you before. And that is a recipe for disaster. Maybe not right now in this moment, but in my case, lifestyle change, traveling from New Jersey to North Carolina, boom, all of a sudden, 25-pound weight gain. Now the stress I told Mike 5 years ago I didn't know. Oh, I know that stress now. It's always been there. But with this type of personality, it's like we teeter right on the edge of mental breakdown, pretty much. Being funny, but also not being funny. Many of us are like right on the cusp, and those same things that you see in the ADHD, autistic kids, we have too. We just compensate much better than they were able to. Yeah. And the compensations, my granddad, we talk about compensations and it's like a badge of honor. Like, I'm fine, I'm good. You're fine and good until you're not fine and good. And the thing is, we don't have a magic ball to know when the body's gonna stop wanting to compensate. Then it's your Achilles blows out. Oh, your ACL. In my case, it was, my shoulder. And it's like your body's like, look, we can't keep making up for what you got going on forever. At some point, the body's gonna give up. And, it's always that final straw. And I tell parents all the time, you look at stories of people who, the 47-year-old mother of 4 who died in her sleep. And, I'm not going to diagnose. I know you have that disclaimer at the beginning of the podcast. So I'll say, I'm not going to say that, I went and did an autopsy, but I'll say that most people, we have these issues that rest below the surface and no one notices until, the heart, all the compensations it has to do for our inappropriate and dysfunctional breathing. And it's a big deal. And when I really came to understand how big of a deal it was like, okay, this myo may be difficult to do at 30, but I'm gonna start it. And so that, and I do some pretty intensive and specific breath work, a little bit more involved than just meditation. I'm in a 12-week program right now that's being run by a breathwork therapist, and we meet weekly, and that's really made a big difference. Getting a good solid bedtime, which is hard, but trying to stick to that. And with the myo and those types of things, and bringing the balance back into the body that like we fight against, but it's so important. Like what you have going on with your podcast, what you're doing with professionals in your professional development, it's big, important stuff. But if you burn out like a flame, like 12 months from now, when really you had a 16-year career, but you only get a year into it because your body falls apart and you're in a hospital bed, that's not good, Yeah. So it's really about living our true potential. And so I'm at the part of my journey where I'm just starting, but trying to really tap into my true potential, because as you kind of alluded to before, most people don't get it. It's like, what do you mean you became a doctor at 25? I started dental school at 21. I was a doctor by 25. I done so many things that people are like, oh, you did all these amazing things before you were 30. And it's like, yeah, but just think about if I wasn't a mouth breathing, overwhelmed, overstressed person, what else could I have done? You know, Dr. Berry was the first person to really turn that question around, you know, because the question is usually like, oh, well, you know, you did all these things, you're good, you know, like, well, no, actually, what if, let's ask, what could you have been if you didn't struggle? Even though you handled the struggle well, you still struggled. What would your life have been like if you didn't? Then I thought, that's scary.
Yeah.
And to do that for kids and other adults and to unleash that. So mostly now what I'm doing is some experiments with myself to directly answer your question so that I can get adults and teens, even kids, but really this older group moving in a better direction with some things that I think may help me. So some of them are a secret until next year. But
That's fine. We'll just have to bring you back so you can share them when they come
love
out.
it, love it, love it, love it. Yeah. But no, it's a challenge. It's a challenge. I mean, you know, you add in what you do. We do similar like crazy professional stuff, but then you have kids on top of it. I have a fiance. You add in these different factors, and it's like, Maya, oh, I can skip that today. So it really is about being intentional and being focused, and it helps me relate more to my patients when I have to be careful at how I, you know, oh, go to your sessions if I'm not also doing the same thing. So it's pretty cool to be able to relate to them on that level as well.
Yeah. So Lily's back in Mayo. So I am that mom of a 5.5-year-old, almost 6-year-old in Mayo. And I'm like, and it's actually with one of my therapists and her son. So it's like a little group Mayo like session that we're doing. She's running it. And I'm just like, she's like, so how's practice going this week? And I was like, I was prepping the house for house showings. And she's like, yeah, we were bad too. So should we reschedule for like Monday, give them a couple extra days? I was like, yes, please. So I'm like, I get it. And you know what? I, as a therapist, try to do, and I'm like not treating right now, but like when I was treating more frequently, I was like, I as a therapist was like, okay, I know real life happens. So I'm not going to tell you need to do this 6 times a day. I'm also not going to tell you need to do it 3 times a day. If you can do it morning and afternoon, great. If you miss a few days, fine. We can still make progress. If you don't do it at all, then we're going to have a conversation. I always try to be, and I was even this way before having children because I don't know, something about me. Maybe I heard somebody say something once and it just kind of clued me into like, okay, Hallie, you don't have kids yet, but you still, you know, you can't have unrealistic expectations. You don't know what it's like to live in that person's household or that family, or you don't know what else they've got going on. But at the same time, we need to educate on the importance of practice. Otherwise, it really doesn't make sense to be in Mayo because they're not going to make progress just coming to a session once a week. So I think that's a very great point. And I think that, you know, great therapists recognize that, yes, we all lead, you know, busy lives, but it also made me really become creative. Like, hey, when you're in the car, when mom picks you up from school, this is what you're going to do. And mom, okay. And so everybody's on the same page here. Great. So in that 5-minute drive home from school to house, boom. So now we're not like, we're not taking away playtime before homework. We're not, you know, so we just got, and obviously things that had to be done in front of a mirror or things that needed to be done at a kitchen table. Then we said, okay, this one has to be done, you know, in a certain setting. But we always try to be really creative in how we can be realistic and functional in getting these things done. And then the other thing that you were saying too that really resonated with me was your entire story, because I just recorded a podcast episode that will have just come out that just came out before this one, that talks about my story. And it talks about how back when I was, you know, 5 years old, or maybe I was going into kindergarten, it was recommended that my mom take me for ADHD testing. And my mom was like, I don't see this in her. Like, I don't see what they're seeing, but sure, they're with her during the day. I'll take, you know, and I tell the story about the 3 different professionals that basically looked at me and like, I didn't get the diagnosis. I was just always marked as the chatty kid, like the over talkative child, getting like S satisfactory for like talking too much in class, despite having like all O's on my report cards and straight A's otherwise. Right. And then I get all the way through high school, I get to college, and I do not do well my first semester in college. And it's like, what gives? Friends are using my notes, getting straight A's, not going to class, mind you, using my notes and getting straight A's on the test. And I got like a C in my business class. And I was like, okay, something is up. And this was like a pattern. It wasn't just that class. So I said to my mom, I'm like, I want to get tested. And so I went and I got tested over winter break. And she said to me, she was like, nobody asked about my sleep. Nobody asked about, all the important things. She said, well, you're highly distractible, and that can really impact your ability to successfully take a test. And you've been so successful to this point of your life. You have a high IQ. I'm not going to give you, like, she basically was like, I'm not diagnosing you with ADD, but you're a candidate for Ritalin. And I was kind of like, and as an adult sitting in my seat right now, I think back to that and I go, what the actual F? Like, what? I don't, you're like falling out of your seat. For those of you not watching this, listening to the podcast, Jasmine is like losing her mind right now. Cracking up.
You can't make this stuff up.
Right? I mean, it was, so here's what happened, right? So here they put a 19-year-old on Ritalin and I'm like, yeah, let's do it. So I hated it. It made me irritable. I couldn't eat on it. I was nasty. Like my demeanor, I was so irritable. I did not want to be around other people. So I would lock myself in my room, which is really a healthy behavior. Like, let's lock ourselves away to study for things, The one thing I did do was I did learn how to study, which was not taught to me in high school. So I did learn that, but I went on to get like B to A average, like high B average the next semester. And then I think it was like a 3.5. And then I got a 4.0 all the way through college and graduate school after that. And again, I was using Ritalin. I was using a stimulant to help me. Why did I have to use a stimulant? Like we should have been looking at, why is Hallie having anxiety during test taking when this was never an issue before? Why do we need a stimulant to focus on not leave gaps in the note taking? And my notes on Ritalin versus off Ritalin were completely different. It was like skeleton versus like full on anatomy and physiology, like no gaps missing. I mean, it was incredible. I still hated this stuff. And I basically self-weaned myself off of it by the end of grad school and only took it for like sitting in 3-hour-long classes or taking a test. So, but looking back at it now, there's so many adults who are getting diagnosed with adult ADHD. And look, if you have ADD or ADHD that's been undiagnosed your whole life, I am not downplaying that. But why? Why is it happening now? And could there be something else going on?
Why. No one cares about why.
Yeah, right. Nobody cares about the root cause.
I have a patient right now who's been on Ritalin. He's 40. And he's been on Ritalin since he was like 16. And he's also on Zoloft. And he's also on, we need a commercial break in here to tell you.
So we're going to give you an upper and then give you a downer and then give you a, let's just,
So nobody like in that moment thinks about the dependency on these drugs. And then like what the other side of that looks like, the severe depression that this guy is in. He's coming to me for help. Like, I got to get off these drugs. Yeah. But like, what if that conversation could have started when he was 16, right? Or in your case, like that early college point, like, hey, like what really is going on here? How do you sleep? How do you breathe? And they don't teach it in school. So I tell parents all the time, it's like, we can't even be mad at the providers because 6 years ago, there's no way I would have done this podcast. I probably would have listened to this podcast like, what the heck are they talking about? Because nobody taught this stuff. I've had to spend hundreds, that's not even 6 figures, let's just say that, to go learn, get education and training. So I always tell parents and other adults, like, if you had the training that I had, you would understand why I can now see someone in a mall and probably tell you all of their different things. I have people, if I really want to blow somebody's mind, I'll have them take their shoes off. And by just having the bottom, looking at the bottom of their soles, I'll tell them about their feet, whether or not they have a scalloped tongue and all these different types of things.
Isn't that cool though?
It is so true. And I didn't mention that when I was in college, I started having this like weird, it started out with like blood and stool, and it just started progressing into a crazy state of things. But because I was 17, I could not get an adult gastroenterologist. And the pediatric gastroenterologist refused to do colonoscopy. They were like, oh, you're too young. Even though like all these signs and symptoms, they were like, oh, it's a fissure. And I'm thinking like, so you have a fissure for a year? I mean, there's no way. I mean, I'm not a medical doctor, but that sounds like crazy. And it's like, oh, it's hemorrhoids. So people have hemorrhoids for a year. There's no way. So finally I turned 18 like a week later, went to a rheumatologist because I was having such bad joint swelling and joint pain that I couldn't work. I was doing a winter break job, and I couldn't work. My fingers were like Nutty Professor swollen. It was crazy.
Mm.
And this rheumatologist asked me 3 questions. And after the 3 questions, he's like, you need a colonoscopy. I think you have ulcerative colitis.
Oh gosh.
So that was when I was 17, 18. So I was on medication for ulcerative colitis up until I started my graduate program for breathing behavior. When one day in class, the professor was talking about how he's an MD, he spent about 35 years, 40 years working with a gastroenterologist together on breathing and its relationship with the gut. And he worked specifically with patients who had Crohn's disease. Well, because I had ulcerative colitis, right? I'm like, Crohn's disease, that's the sister of ulcerative colitis. So after class, I asked him, I was like, hey, doc, can you tell me, like, what did you do with this guy? Like, what can you break down how breathing is really related to the gut? And he started telling me about how we have this system that's unique to us as humans, where the gut gets cleansed in our sleep that many people don't know about. They don't talk about in medical school. And just the difference, the different things about carbon dioxide and oxygen. And he taught me just a few simple breathing techniques, right? I have not had to take my medication for approaching now 3 years for ulcerative colitis, and I have healed my gut simply
Amazing.
by breathing. And it's crazy because I think back to the time where I was struggling for this diagnosis, right? And the medication, of course, helped me, but like you, I started self-weaning. And I just think about all the adults who don't have the courage, because it's hard when you're self-weaning off of a medicine that's actually helping you, but in the long run, it's probably going to harm you. Like, that self-weaning process sucks because it's like, oh, I'm going to have to deal with the pain that this is helping resolve, but like, I got to be strong. It's hard. But to look at that point and all the uncertainty, and if someone has just said, tape your mouth or go to myo and learn to breathe with your mouth closed, I could have prevented what was like a decade of this medication that only God knows what it's done to my body in trying to resolve a condition. And it's no disrespect to ulcerative colitis or Crohn's disease, they're real conditions. But there are people who have conditions that mimic those conditions that get these medications. Then yes, the medications help us, but breathing also helped me. And look at we're almost 3 years in. It's just crazy to me when I think about the knowledge gaps that we have in our system. But I'm excited that there are doctors who want to learn this stuff, who get intrigued when I talk about resolving, gut problems with breathing. They're really intrigued by that. I think that's great. And I just, when you started talking about what you experienced, I thought, man, that sounds like the struggles that I had with my gut problems.
Yeah. Well, and I've been lactose intolerant my whole life. I had a dairy allergy when I was in, like, probably up through, I don't know if it was high school or early on at some point. That's all blurred because I'm still lactose intolerant, so I don't need it. Or I take a lactate pill. Right now I've cut it out because I just feel so much better without it. And it's interesting too, because as a freshman studying, I was like all hopped up on Diet Coke and peanut butter and Ben and Jerry's ice cream. We're not going to pretend like I was the healthiest freshman, not gaining freshman 15 or anything. Of course I did. But this was like my study diet. Like, let's use, some caffeine, some sugar, and peanuts. It was not great. But I developed a peanut allergy. I remember sitting there and all of a sudden my throat got really itchy and it felt funny, like almost like it was kind of getting a little smaller. And I was like, that was weird. And I just went on, like, not thinking anything. And here we go the next night. I'm studying again. I sit down, I take a spoonful of peanut butter, I'm eating my Ben and Jerry's ice cream, and I'm like, oh shit, like my throat, something feels really not good. And I'm really lucky that I didn't have like a more severe reaction. I did go and get tested. And the allergist was like, yeah, you've developed a peanut allergy. And I ate peanuts my whole life prior to that. So it was really interesting to me because it was also like, this was the tipping point for everything. This is the point when I developed a peanut allergy, which, by the way, 6 years later, getting healthier and like having a healthier gut, like that allergy was gone by the time I was like 25. And they do say that allergies can come in 6 to 7 year cycles, which I never knew about that until this was brought to my awareness as a patient going through this. I was like, wait, what? This is not like a lifelong thing. You can cure an allergy. That's kind of cool. And I really didn't do anything specific to cure it. I just didn't eat them for 6+ years. And then when it got retested and they said, your body is not reacting like it did in the prior tests. And I remember sitting outside. They were like, most people sit outside our office, which is right next to the ER, and eat their first peanuts just in case. So I remember sitting in the parking lot, like eating like some peanuts because I was like so sure that something was like not going to go as planned. It was fine. But oh my gosh, it was crazy. And it really it made me realize, like, for me, that was my tipping point. I was not doing well in school. I clearly was not sleeping well. I had anxiety. I wasn't an anxious person normally, but I had like this test anxiety that, it's like I would sit down and I was so hyper vigilant to like everything around me that I could not focus on the test. And I would reread things like 5 times over and still not process what that question was saying, even though I studied and I knew the information. That was a crazy part. I share in the podcast how for this one test, I went back like a week and a half, 2 weeks later. And I was like, can I review the test? Can I just see what I got wrong? And they gave me the test and I'm like, I know 13 out of 15 of the answers I got wrong. And I have not studied in the past 2 weeks. And we've moved on to new material. Like what gives? Like what? That's bizarre, right? And that's what opened my eyes up to like, okay, something else is at play here. And I want to get to the bottom of it because it's not a matter of me not knowing the material. It's a matter of I knew it, but something prevented me from being able to demonstrate that or retrieve the information during that specific time that I was tested on it. So, it was a very interesting, eye-opening experience. It was like the gut was a mess. I'm sure my sleep was a mess. I'm sure that, like my weight was not great. Like I was all over the map. Okay. Like it was, that was the last straw. And then I thought everything was good and dandy because here I go. And I get on Ritalin, which also was probably not good for my stomach because Ritalin has lactose in the methylphenidate pills. So, every time I would take the medicine, I was like, gotta go to the bathroom. Like it was like clockwork. I could not eat. I could not drink any caffeine on the Ritalin. Like it would make my heart race. I could barely eat certain foods, like the foods that, and I'm not kidding, I actually went on the medication in grad school. I went from a size 8 to a size 2, like my first year of grad school. And I did nothing differently other than I was getting like 8 hours of sleep a night. I was not going out and drinking with everybody at night because I was like, I can't handle this. I don't have the capacity right now. I don't know what my intuition was telling me, but I'm like, I know this means I'm being like antisocial, but like I have to be this introverted person right now. And this is what's best for Hallie. And I would just go back and do my work. And I would do, I wasn't exercising really because when I exercised throughout college, that seemed to do nothing for me. So, but it was crazy. I went from a size 8 to a size 2 and I was eating like, freezer meals, like what the smart meals, whatever they were, for lunch. And my parents were relatively local. Like they lived like 40 minutes from University of Maryland and in Montgomery County, Maryland. And so my dad would like go to Costco once a week and like bring me a delivery of stuff. But I was like, hey, can you get me grapes? And can you get me, it wasn't like, yes, I ate some healthy stuff, but when I look at my diet, it's comical. I'm like, how did I go from size 8 to 2? Like I was just in this stress state. And I know even though I was sleeping 8 hours, I was not getting quality sleep. And I know that it's just, the whole thing is very fascinating to me. So yeah, I don't know. I think it's always important to talk about all these little tidbits of like our experiences and our stories because other people, like you were sitting here and I'm going, me too. And it's like when you start to hear what other people have been through, when you don't know the back end of how they got to where they are today, and all you see is what appears to be glamorous on social media, I'm like, oh no. If you only knew that story.
and what's crazy is you will appreciate this because you're a mom. It's funny, we can laugh about it, right? Because it's us. But if we were to say that your child was struggling, it would not be a laughing matter anymore. But like, wait a minute. So I told parents, it's like, it's really cute when it's just us, right? But when we like, if you know that this is what we're going through from teenage years, because the body usually compensates that second decade. So it's not an accident that you and I had the experience and others around that same point in time about the second, if you're lucky, third. But usually about that second decade, the body's like, our cup runneth over. We're tired. Mm-hmm. We have been making up for your BS for a while and we're done. But it's like, if you know that that's possible, if you start to see those things in a 2-year-old and a 3-year-old, I was chatty catty 3-year-old. I can't remember. It was on Allison's podcast, her amazing podcast. We were talking about, she said professional speaker since 3, because I was telling her that at 3 years old, I was on stage with an audience of about 350 people at church. And so she's like, so you've been a professional speaker since you were 3. I was like, I guess, but but I was that kid that, talked too much, talked too fast. I mean, the signs, the patterns were there. Just no one knew to notice. So now that we know, it's one of those things where we really have got to be intentional about getting the help, because the solutions are so easy. Myo is so fun for a kid. Myo brace, these things are so fun and cool. They're not cool at 30. They're just another thing. It's just a burden. It's an extra thing. It's a job that you have to pay somebody to teach you how to do. It's just not cool. But at 3, 5, it's exciting. It's the best time to intervene. And actually, if you do it at like 6 months and start that integration of reflexes, get that nervous system ready, and like in infancy, man, nobody remembers 6 months. Well, I shouldn't say nobody. In my class, some of my classmates told me about birth stories that they could remember, which is crazy. I cannot remember my birth story, but most people cannot remember. They were 8 months old. Most people can't remember. So getting that stuff out of the way, starting with the end in mind, is just such a big deal. So the habits of highly successful people, and we all want to be highly successful people. We have to start with the end in mind. And these stories are just so, kind of fun. I mean, they're hilarious, actually. I almost fall out of my chair, but they're hilarious. But then when you think, like I said, you think about one of your children suffering with this stuff, it's no longer funny now. It's like, my God, like.
But you want to give them the best opportunity at life. And that's, and that's where I'm even looking at my 3-year-old now. It's cute. And like you said, it's fun for them. Like, my 5-year-old is like, do I get to do Myo today? Is it Myo day? And then my 3-year-old is like, don't start without me. And I have to sit them both in front of the computer. And thankfully, like in most cases, we don't usually have siblings, unless it's like, unless it has to happen. But because it's one of my therapists who's doing the Myo with them, she lets Mia sit there and participate. And Mia's like, Mom, am I doing it right? Am I doing it right? And I'm like, to see the enthusiasm and the excitement in a 3-year-old who thinks it's so freaking cool, and like a 5.5-year-old who's excited to do it with a friend, it's like you said, it is so much easier because we can make it fun for them. Whereas it's just another thing on our plates as an adult. So do it early. 100%.
Yeah.
Yeah, well, this has been amazing. Thank you so much for chatting with us and sharing your story and allowing me to expand on my story. We are like the same person. So it's, I'm sure we could probably sit here and just continue to unravel like more likenesses across our life events that,
we'll save that for when we see each other in October. So
exactly. Looking forward to it.
Yes.
Well, awesome. Thank you so much, Jasmine.
Thank you. Thanks for having me.
Absolutely. And let me add this real quick too. If anybody wants to find you, where can they find you?
Yeah, so I'll have a website, I guess, by the launch of this podcast, drjasmineelmore.com. And my non-professional Instagram, my personal Instagram is rich_sleep. People can find me there as well.
Perfect.
Or on your podcast again in the future.
Of course. They'll find them here on the podcast. We'll link that in the show notes so that when people are listening, several weeks from when we recorded it and beyond, they'll be able to come back and find you if they're in the North Carolina area looking for, so do you also, you mentioned you do consults. Do you do consults outside of North Carolina since that's not really medical advice, or how does that work?
I'm happy to consult with people and just kind of have these chats. I have people who call me all the time for non-professional, professional medical advice, and I connect them. So my name is the Sleep Plug. I connect them with providers locally and give them an idea of what treatment plans may look like. And
awesome.
Happy to do that too. They can just send me an email to ineedrichsleep@gmail.com.
Perfect. Well, thank you, Jasmine. Appreciate it.
Thank you. Appreciate it. It was awesome.
All right. We'll chat soon. Thanks for listening to this podcast. If you want to hear more of these Myo, TOTS, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts or pledge a small amount on patreon.com/the Untethered Podcast. If you found value, others in this space will too. So be sure to share this episode on your social media platforms and join us over on Facebook, on my Facebook page at Hallie Bulkin Biz, on Instagram at Hallie Bulkin, and you can head over to theuntetheredpodcast.com to grab a copy of the show notes, where you can also subscribe to be kept up to date on the latest podcast episodes.